So when we were discussing our patient case yesterday afternoon, it went pretty well overall. The injury was pretty straightforward in what it was. The signs and symptoms were pretty obvious. So the injury was an ACL injury. It was an ACL tear. Maya, who had the patient case, felt laxity in her knee, kind of felt it was like more quote unquote wiggly than normal. We did the Lockman's test. We did a couple other tests to rule out if it was an ACL or rule in if it was an ACL in this case, and then rule out MCL, meniscus tear. So Lockman's anterior drawer, we did all that, and those two specifically were for ACL. And she had pain in those. She didn't have pain in any of the other tests, so that almost gave us a clue right there. It was ACL. We asked her some questions originally, just kind of like history. She's only had like minor ankle pain before and sprains. Other than that, she had no previous knee injury. It hurt to like put pressure on it. Her to walk. She had crutches at the time. The pain was like a 8 out of 10 originally. When we evaluated her, quote unquote, a couple days later, the pain was down to about a 6 out of 10. This one went a lot smoother than our first one. The injury was also more straightforward and kind of more given. So, yeah, overall, I think it went well. We did the muscle manual test. We did the range of motion. Those went smoothly. Things we struggled with. I guess there's only one thing that we kind of struggled with, and that had to do with making sure we did all of the correct tests. Because originally we didn't test for, I believe it was the MCL or meniscus, one of them. And Maya was just like, well, you probably want to go and, test for that. And so Monte tested for it just to make sure. And of course, the pain was negative. So we didn't exactly do all the tests originally. I mean, other than that, it was almost right from the beginning. We originally diagnosed it, not diagnosed, but we kind of assumed it might be an ACL injury just based off of the history she was just telling in general. And then everything else that we did on top of that added up, and yeah, ended up being an ACL injury. And yeah, that was it. Everything went pretty smoothly.